it always starts with listening. So listening to organizations and the clients that I'm working with, listening to communities, they know what they need. Often it's just about listening to them and giving them the space to share it. And then pairing that with things like quantitative data that we already have to build a picture of what's happening in a community and why. And then making sure to translate that data into something that people can actually use. So that might be taking insights and putting them into a strategic plan, and collaborating on that strategic plan with communities and stakeholders, visualization of data. So what I had talked about before is our insight to impact roadmap at Piat Public Health. So really starting with that understanding, going to insight, and then moving to strategy and action.
Hey friends, welcome to Public Health Careers. I'm Omari Richins, founder of the Public Health Millennial and host of Public Health Careers. Join us as we dive deep into public health topics and career journeys. You'll hear diverse career stories, absorb professional development and career strategies to help you learn, navigate, and transform your public health journey. On today's episode, we have Alexandra Piatkowski. Alexandra is the founder and CEO of Piat Public Health, a consultancy that partners with public health, healthcare, and social impact organizations to conduct community health needs assessments, strategic planning, and evaluation that center both data and community voice. She's a public health leader, epidemiologist, and certified project management professional who specializes in transforming complex data into actionable strategies that improve community health and advance equity. She conferred an honors Bachelor's of Science in Health Studies at the University of Waterloo, and then she conferred a Master of Public Health with a concentration in epidemiology at the University of Toronto, Dalla Lana School of Public Health. In today's episode, you'll hear and learn more about why the need for effective communication through various formats and stakeholder engagement is essential in public health, how to craft needs assessments that stand out and can be shared in various contexts, what is a co-op education and how it can transform your career, why it's important not only to collect data just to have it. Data only matters when it's actually used to inform decisions, drive action, or improve outcomes, what getting feedback from key stakeholders and community members could look like, and much, much more. Be sure to enjoy today's episode and hit that subscribe button.
Hey, this is Alexandra Piatkowski. I'm the founder and CEO of Piat Public Health, and you're listening to Public Health Careers.
Alexandra, welcome to the show.
Thank you.
I'm super excited to have you here. And I know that we've been connected for a while now. And I know that you've recently, or not so recently, started your consulting business. So looking forward to diving into your story and learning more about how you got there.
For sure. Me too.
And before we do any of that, would you like to start us off by telling us how you identify and a little about your personal background?
Yes. So my name's Alexandra Piatkowski, or Allie for short. I use she, her pronouns. I'm originally from Kitchener-Waterloo, Ontario, Canada, which is about an hour and a half outside of Toronto. I've lived in Toronto for the past 10 years, ever since I moved here to do my master's. So it definitely feels like home now. So I'm very much a city girl. I love the diversity of the city, exploring the city in different neighborhoods. But I do love nature as well, and getting outside of the city and doing traveling. I love spending time with friends and family, sports, staying active. And I'm also a huge foodie and love doing karaoke whenever I get the chance.
Love that, love that. Well, thank you for sharing that, and I'm sad to hear that because I was actually just in Toronto maybe like a month ago. So I'm sad that I didn't realize that, or else I would have reached out to meet up or something.
Yeah, next time.
Yeah, yeah, definitely next time. And considering that you're a foodie, I can imagine that you enjoy yourself in Toronto because
definitely.
the
There's
diversity,
food. Yeah.
right? The diversity of food there is amazing.
Yeah, food from all around the world. It's awesome.
Yeah. Awesome. Well, thank you for sharing that, and would love to dive more into some of like your expertise, and before we jump into more of your public health story. So you're known for taking complex epidemiological or evaluation data and making it accessible. What are your go-to strategies or frameworks for simplifying and communicating impact?
Yes, for sure. So that's something that's very important to me. I never want to just collect data for the sake of collecting it, or have a boring report that never gets read or used. So it's very important for me that the data that we collect actually gets used. So something that I like to use is called the Insight to Impact Roadmap, that I developed as part of my consulting organization, Piat Public Health. So that helps us to go from insight to action, basically focusing on who the audience is, what the message is that will resonate the most with them, how a particular piece of information can be visualized. So, for example, is it a graph or image or words or a combination of these? And then also getting feedback on the data from key stakeholders and community members to make sure that we're presenting it in a way that resonates with them. And then it's always helpful to have multiple versions of products wherever possible. So maybe you have a longer needs assessment report, but then also having a shorter executive summary that's more visual, more infographics, having web based information, social media posts, that type of thing, different ways of reaching different audiences.
And how do you think about, like, after doing a report, sharing out that information or like marketing it, if that's the word we want to use, like marketing the info or the needs assessment for per se?
Yeah, for sure. So I think involving people throughout the process, like who have actually participated in the needs assessment. So different stakeholders from different health and community based organizations and community members, and also getting their thoughts on what would be most helpful to share the information, how they like to receive information. So, do they prefer like print based information, emails, social media posts, websites? Do they want to have an in person meeting, like a town hall or something that's presenting the information? And probably it's going to be a combination of those different things, and just making sure that there's something that meets the needs of the different segments of your audience.
And then considering that you shared that, also for, like, I guess, dissemination purposes, you think about getting community feedback on, like, how do we present this, or like what does that look like? Is that like just a focus group or a survey, or what does that look like?
Yeah, it can look like different things, but focus groups and surveys are definitely two key methods. Those are ways that we use to gather feedback for the assessment in general. So, when we're asking things like, what do you think are the biggest health needs in the community, or what would you like seen done in the community to address these needs? We can also ask questions like, what would you like to see done with this information, or how would you like it to be presented to you? And even getting their feedback on like preliminary drafts of the reports or of some of these different products so that they see them before they actually go out. But yeah, that can definitely be done through a focus group, a survey, interviews with people, posting like a draft of the report on a website, and just giving people different ways that they can provide feedback.
And how can public health professionals sharpen their storytelling and visualization skills to support policy and program change?
Yeah, so I think a lot of it is through practice. Like the more you do it, the easier it becomes, and you learn things along the way. I think focusing on storytelling is really helpful, in terms of getting at the people behind the numbers, and really combining that quantitative data with the more qualitative pieces, that can really resonate with people and actually hear about what's happening in the community. Ideally, that's going to allow people to resonate with what you're sharing and better understand it and want to do something with the information rather than just looking at a statistic. And then in terms of the visualization, obviously, there are tons of different ways to visualize data. So I think just learning about the different options that are out there, different graphing techniques and infographics and photography and images and icons, and probably using a combination of those different approaches, but not being afraid to be bold and to use colors and just to have a variety of different ways of sharing data. Of course, there are tons of different tools out there like Canva and Power BI and Tableau. So it's helpful to learn different types of software and different tools, but also remembering that it doesn't necessarily have to be that fancy and that complicated. And the more important thing is that you're telling the story of the data and visualizing it in a clear way. You don't have to have the fanciest graph in the world as long as it makes sense to people.
Yeah, and I like how you started off by saying, you have to practice it. You have to actually do it to get
Mm-hmm.
accustomed to what it looks like and how you can build and learn. And I feel like that's like a process in many things in life. You build something, then you learn about the mistakes, you iterate and you build again.
Mm-hmm.
And but definitely a huge advocate of people like just getting going and learning
Mm-hmm.
as you go, because you find the road as you start walking, as they say. You've led both internal operations and community facing strategies. What's the biggest lessons you've learned about balancing both?
Mm-hmm. So I think the biggest lesson is that they're very connected with each other. So you can't just focus on one. You need both of them and they influence each other. So when you have trust within your organization and things are working well in terms of communication, it shows up in how you engage with communities as well. And you can basically do your job better in terms of working with your clients and communities and create stronger partnerships. And then when things are going well in the community and with your client engagement, that's very positive in terms of team building, and it helps you learn how to continue to improve moving forward.
Yeah, that makes sense. Like having a space for both of those perspectives and knowing how to move forward. And I guess it is also like very contextual on what the project is, the stakeholders, and who, I guess, what the outcomes that you're trying to really achieve in the project as well.
Mm-hmm. Yeah, definitely.
And then shifting a little bit, you've mentored through Rosie Mentorship, the DLSPH program, and more, and you offer mentorship as one of your services. Why is mentorship so important to you?
Yes. So anyone who knows me knows that I absolutely love mentorship and I'm always posting about it and I'm a huge advocate for it. So it's really shaped my journey. I've been lucky enough to be both a mentee and a mentor many times in both formal and informal ways. So I think that's important to remember, is that mentorship doesn't always have to be part of a formal program. There are lots of ways to do it informally, and I think it's good to pursue both opportunities. It's really just a great way that we can support each other, both professionally and within our lives. Obviously, I'm a huge advocate for it within public health, but it's very important in all fields. Um, if there's anything I can ever do to give back to people and share my experiences and just make things a little bit easier for them than they were for me, then I want to be able to do that. So I think that's really my driving force behind mentorship. But I've also learned that it's really not just a one-way street. So I've always learned just as much, if not more, from my mentees as I hope they've learned from me. And as you said, that's also why it's been really important for me to include that as part of my own consulting, and to be able to offer mentorship to even more people.
Are there any specific challenges that you see people coming to you for?
Yes, definitely. So there's obviously so much going on, politically and in the job market, which would be a whole other conversation, but people are struggling to find work, even people with, lots of education and lots of experience, or are finding, themselves laid off or out of work, or the path that they thought they were going to take isn't as clear as it once seemed. So people are definitely coming to me with those challenges, and just not really knowing where to go next, and feeling like, wow, I tried everything. I feel like I'm doing all the right things in terms of networking and job applications and my resume and interviews, and it's just not working out. So I think that's a common challenge that a lot of people are facing.
Yeah, and I have seen or heard a lot of the same, and we know that the macro landscape has changed in drastic ways in recent times, and is creating maybe like more challenging environments for not only like early career professionals, but people who are probably have more experience as well. So yeah, that definitely makes sense.
Yeah, definitely. And, there aren't always good answers for that. Unfortunately, there are a lot of things that are out of control, but what is within our control is just being able to be there for each other and support each other, and at the very least, listen to each other. Maybe I know someone who has experience in the field that you're looking to get into, or has been through the same experience as you're going through, or sharing resources, especially free resources. We are lucky to have a lot of those within the public health field, and that's especially important right now. Like, just sharing everything that we can and not gatekeeping information.
Yeah, absolutely. It is like no way around it. It is a tough place right now in public health, and it's important work, and you need to lean on your community and find ways
Mm-hmm.
to continue to persevere throughout these challenging times. Because we need you, we appreciate you. So thank you for all that you do. Whoever's listening to this and needed that. So before shifting a little bit to your academic pathway, what does public health mean to you?
Yeah, that's a great question. And it's always good to reflect on, because even if you work in public health, you don't necessarily take the time all the time to reflect on what it really means to you. But to me, it is about caring for people and populations, and making the connection between data and communities, between evidence and what's actually done, involving the people who are most affected by issues and decisions, and getting their input and creating the space for them to actually be able to drive strategies that improve health equity. And then also, what I think is, it's not just one thing, it's many different things. Of course, just about everything in the world influences public health, but I think sometimes there's a narrow view of it, like it's just infectious diseases, or health behaviors. But it's really a very broad field and very multidisciplinary. So I think it's important to remember just how many different things it encompasses.
Now shifting to your academic pathway, you got an honors bachelor's of science in health studies at the University of Waterloo. What drew you to study health studies, and what did you take away from your time in Waterloo?
Yeah, so I knew for a very long time that I wanted to do something health related, but I didn't know exactly what. But two of my favorite TV shows growing up were Mystery Diagnosis and Dr. G Medical Examiner. I don't know if you've seen those, or if anyone
Yeah.
else listening has. A little bit morbid, but very relevant to public health, just in terms of kind of the detective aspect of it, and figuring out what was going on. But I always found those really interesting. So I thought, okay, I'm interested in health. Maybe I'll do something clinical. But I think obviously clinical work is important and great, but I was thinking about that route because I didn't really know about the other options that existed. So I was drawn to health studies because it was a general health related program and would allow me to pursue different career paths within health. But I had no idea just how much I was going to love it before I started it. It was just an incredible program, so interesting. I loved how it gave me a strong science background, and then also focused on the social sciences, health systems, health policy, public health, epidemiology, so many other things. So it was very multidisciplinary, like we were talking about before. And I remember, taking classes about the social determinants of health, and that's really what made me fall in love with public health. It just really clicked for me, thinking about how health is shaped by so much more than our choices and our access to healthcare. It's really a lot about the conditions that we live in, and it made me realize that I was more of a big picture person, and wanting to focus more on health at a population level and help to address the injustices in our society that can't be addressed at the individual level.
Well, I appreciate that perspective, and also wanted to ask because I know at University of Waterloo. Interestingly, I have like a family friend that went to University of Waterloo as well,
Oh, really? Yeah.
and that was the first time I actually heard about like co-op programs. And then later on, I had another friend who went to Northeastern University in Boston, and they also had a co-op program. Um,
Mm-hmm.
was that something that kind of drew you to the school, or and what was that experience like for you doing co-op programs? And before you answer, the co-op programs that you worked for Trillium Health Partners, Health Canada, and Cancer Care Ontario.
Yes. So, great question. That is definitely a big part of what drew me to the University of Waterloo specifically. They're very well known for their co op program. They actually have the biggest one in the world. And for anyone who doesn't know, basically what a co op program is it allows you to get full time work experience within your degree. So, it was a 5-year program, and then I was able to get almost 2 years of full time work experience within the program. So that was amazing. I mean, I learned just as much through those experiences as I did in the classroom. And, it's not the type of placements that students sometimes unfortunately get put in where they're getting coffees for people. It's really like hands-on experience and real work and learning experience. And I was able to get experience in different areas of health and the healthcare system and public health, and try out different things, find out what I liked, what I didn't like as much. So I'm really grateful for that.
Yeah, that's awesome. And yeah, definitely a huge advocate of co-op programs as well. Cause like as you're saying, you have that built in. They both have like a network to help you and support you get into those opportunities. And
Mm-hmm.
from what I've seen in my anecdotal data, people do really well when they are able to go to programs where they are in co-ops and they're like actually applying themselves and whatnot. I wanted to ask, so you're studying health sciences, not really sure what you want to do in the world of life. You come into your SDOH class, and how did that maybe c- alongside your co-ops, or did that come before your co-ops so that you're able to kind of
Mm-hmm.
align the opportunities, or how did that work out for you?
Yeah, great question. That came very early in
Okay.
my degree. So, we started right away talking about the social determinants of health, and just kind of population health and public health and what that is, and like taking more of a systems thinking approach. So like right away that was kind of the lens that we were going through our entire degrees with. And it did influence what I did within my co-op experiences. But at the same time, as great as the program was, and I was able to do a lot of different things, there weren't necessarily as many placements within like public health or
Mm.
health equity. I would say more of them were in the clinical space or the research space, which was great experience as well, but a little less relevant than maybe what I was, my ultimate goal of what I was interested of getting into, which was more the public health space, as I discovered during my degree. But at the same time, I tried to go in with a really open mind and just be open to having a variety of different experiences and learning from them in different ways and gaining transferable skills. So we'll talk a bit more about my co-op experiences in a minute, but that's why they're all kind of a little bit different. And I intentionally tried to work at different types of organizations.
Yeah, that makes sense. And I guess the first thing that comes to mind is, if you're going into a program that has a co-op, maybe try to find out if there are
Mm-hmm.
partnership sites that are related to the things that you want to do beforehand, if possible. And
Mm-hmm.
then I guess like even to the point of, we sometimes learn by doing things that we like, and we also sometimes learn by doing things that we don't like. And maybe that was
Yes.
a case a case for you, like while you're still learning like tangible skills, getting experience, you're getting a grasp of like, oh, maybe this is not ideally like where I want to go, which I think is like what you're actually like trying to do in undergrad. You should be trying to figure out like what is that I do and
Mm-hmm.
don't like, as best as possible.
Mm-hmm. Yeah, absolutely. And you can learn just as much from what you don't like as what you do, and it can help you to kind of refine what your goals are. And sometimes you don't know if you're going to enjoy something until you do it. You might think, oh, this isn't really my interest area, and then you get into it and you discover that you actually really do like it. So that's another reason why it's important to try different things.
Yeah, absolutely. And how did your experience in at Trillium, which was one of your co-op roles, what did you learn about health systems and data?
Yeah, so that was a really interesting role. That was, really my first office job and first kind of direct experience within the healthcare system. It was a very interesting time for the hospital as well because they were going through a merger of three different sites into a health system. So now it's a very large health system, and each of the hospitals was already quite large themselves. But it was very much a period of upheaval, and figuring out how they're going to standardize care and the policies and procedures across the different sites, and kind of merging teams and figuring out HR, like who's going to be in different roles in the newly formed departments, and just kind of being involved and being exposed to all of that was really interesting and a huge learning experience. At the time, they were also still doing a lot on paper in terms of like care documentation, and HR records, and there were logistical challenges around that, and of course that really affects how data is documented and stored and able to be shared. So it just showed me a lot about the challenges that the healthcare system was facing, and how those were working to be addressed, but how much time that takes to be addressed, and how far behind healthcare really is from a technology perspective.
And then your other co-op roles were at the organizations were Health Canada and Cancer Care Ontario. What were the roles that you had, and how did those kind of like help to shape your perspective on wanting to continue on in public health?
For sure. So Health Canada was really interesting. It was with a department that was called the Natural Health Products Directorate. So basically, what they do is to regulate natural health products. So things like a lot of vitamin supplements, but also like a lot of toothpastes, sunscreens, things that are health related products, but they don't have pharmaceuticals in them. So they have their own regulation system apart from pharmaceuticals. So my role was basically reviewing licenses that companies license applications that companies were submitting to get their products approved for market, and just kind of being that first step of review. So making sure the licenses were complete, they had filled everything out, they had all the information that they needed to, and then working with those companies to address any issues. So, I learned a lot about customer service and communication and working with people. So that was really interesting. And, just really enjoyed being able to get that experience at the federal level, work for a large government organization, and to work on something that was important like that. It was really important that these applications were complete and truthful, and that being able to contribute to making sure that the products that we're going to market were safe and effective.
And was that a similar role that you had at Cancer Care of Ontario as well?
Yeah, so that one was a little different. That was at the provincial level. It was basically a lot around system performance data and, looking at how well the province was doing around, cancer statistics and health outcomes, and putting together a dashboard that put together those different pieces of data. That's probably most similar to what I'm actually doing now, like being able to look at population health data, and be able to put it in a form that's understandable to different audiences and the public especially. So that was really interesting, and very relevant to epidemiology, which I ended up focusing on in my master's.
And would you say that was like a key reason for you focusing on epidemiology as opposed to some other concentration in public health?
Yeah, I think so. I think, it really kind of influenced me to go in that direction. And, I'd always been a data person. I loved public health as a whole, but I think data was something that was particularly interesting to me in public health, and I wanted to focus on, and Epi would allow me to just build some more skills in that area.
Awesome. Right. And like going back to what we were saying, like just getting your hands into different things to kind of see where you do have interest, and then from that finding out that it's something related to data, going into epidemiology and figuring that out. Before we get to your Masters of Public Health, were there any undergrad takeaways that you had, or that you want to share?
Yeah, I think, it was just a great experience in program. Like I said, it really kind of like shaped my future in health. I knew I wanted to do something in health, but it really helped me to refine that and to know that I wanted to focus more at the population level. And then the co-op experiences were just instrumental, getting that much work experience and that variety of work experience, at the organizational system level, the federal level, the provincial level, and different types of roles, from administration to regulatory affairs to data analysis, was really helpful and definitely shaped where I went after that.
And correct me if I'm wrong, but you, after undergrad, you worked at the Canadian Medical Association before then getting into your Masters of Public Health with a concentration in epidemiology at the University of Toronto Dalla Lana School of Public Health. So tell us maybe about that experience, and then about the decision to apply and go to a Masters of Public Health.
Yeah, for sure. It's a very long name. So I had a great experience working at the Canadian Medical Association. It started off as a summer job that I had in between my undergrad and my master's. I was a data analyst there, and really focused on developing surveys and analyzing the data from those surveys for the physicians across Canada who were members of the association. So we'd survey them on different topics and sometimes controversial issues like end of life care and substance use, and basically take their opinions to inform what were the policy issues that the CMA was going to advocate for with the government. So that was super interesting and felt very impactful. And then I was able to continue that role in a part-time capacity while I was in the first year of my master's. So, that was great to just continue to be able to have that position, continue to get experience. And then at the same time, before that, I had decided to apply for that master's program at University of Toronto, Dahlana School of Public Health. So what drew me to that program is, I knew I wanted to do something in public health. I was interested in data, so I thought epidemiology would be a good fit, and wanting to get some very practical skills, along with kind of getting a broader education in public health as a whole. So that's why I didn't necessarily do like a specific degree in epidemiology. That's why I decided to do a master's of public health with a concentration in epidemiology. And I really wanted to do like a very practical course-based program. I was less interested in research in academia, and with having all of my co-op experience in my undergrad, I wanted to have something that would allow me to continue to get practical experience. So within that program, they have 2 practicum placements as part of the program, which are very similar to co-op experience, a 4-month full-time work experience. So that's why I decided to apply, and I'm very happy with my decision there.
Well, I'm glad that you're happy with it. What were those practicum experiences, and what did you take away from them?
Yes, so my first one was as an epidemiologist at Public Health Ontario. So that's really, the Ontario Public Health Agency. I was in the vaccine safety department. So our focus, or my focus for my time there, was to develop the annual vaccine safety report. So that's basically analyzing data around adverse events following immunization, and presenting it to the public. So, it's basically cleaning and analyzing that data and making sense of it, and then writing the report and doing a lot of data visualization. So that was really interesting, and really enjoyed being able to get that traditional epidemiology experience at a government agency and really applying my skills that I was learning in the program. And then my second practicum experience was at an organization called Amplify Care. It was called the eHealth Center of Excellence at the time. They just recently changed their name, but basically they're all about helping to improve the flow of information across the healthcare system through the use of digital health tools. So helping organizations to implement those. I was on the program evaluation side of things. So basically evaluating the use of those tools, how effective they were, what was the patient and provider experience with using them. Were they helping to reduce the administrative burden for healthcare providers? What was the impact on health equity? Because they really, these tools have the ability to improve health equity, but also to increase health disparities depending on how they're developed and implemented. So that was really interesting as well. And again, it was quite different from my first position. I kind of took a similar approach within my master's, trying to get a variety of experience with the 2 practicum placements that I had.
Yeah, absolutely, and it kind of sounds like both of those kind of play into some of the things that you do currently with your consulting business, and I think it's so important. Like, we never know like what are the skills or the skill sets that are going to really resonate with us, or that we're going to be able to use to make impact outside of our schooling. So appreciate you sharing that. What lessons did you take away from your MPH program?
Um, I think the importance of relationships and connections. One of the best parts of the program was, as I said, it's very practical and hands on, but part of the reason for that is that many of the professors at the school are adjunct professors, and they have other roles in the community or like with different government organizations or hospitals or research institutes, and then they're bringing their real world experience to the classroom. So that was really great. So being able to make relationships with them, make relationships with my classmates and friendships. Many of us are still friends to this day, which is great personally, of course, but also professionally. And we support each other. And, you never know when someone might be working in a position with an organization that you might be interested in, or vice versa, or that there's a way for you to collaborate professionally. So I think it was, a great networking opportunity. Of course, really enjoyed the program and the academic portion of it, and it showed me that I was kind of on the right path with public health, and it was something I wanted to continue to pursue. And then the practicums were just a great way to apply the experience in the real world. And fortunately, with that amplified care position, that's something that I was able to turn into a full-time position after I graduated as well.
Awesome. And yeah, I'm glad that choosing epidemiology like solidified your
Mm-hmm.
feeling and place in the world, and would love to hear more about how that went from I guess co-op practicum to full-time position. But thinking about how did you navigate that coming out of graduate school to then like use this program evaluator role at Amplified Care to turn it into a full-time position? How did that work for you?
Like, how was I able to turn it into a
Yeah.
full-time position? Yeah, great question. And I feel lucky that I was able to do that. But I really enjoyed working at that organization, not just the work that I was doing, but it was a great place to work as well. Really good culture and a small, close knit team. So pretty early on during my practicum there, I thought this might be an organization that I'm interested in working with in the future. So early on, I brought up if that might be a possibility to turn it into something full time in the future, or if there might be future opportunities, and then just kind of continually bringing that up and not being afraid to do that, and just making it known that that was something that I was interested in. It didn't happen overnight. I will say that I did take a little bit of time off after I graduated and after my formal position was finished. But then, I kept in touch with them and was able to turn it into a full time position a few months later. And, the work that I was doing in my new full time position there was quite similar to what I had done in my practicum. So it was kind of a natural transition in that way.
I love that. I love that you were like, I am gonna plant the seed. If it dies or not, that's not my like I can't play into that, but I'm gonna plant the seed and I'm gonna continue to show up and do the work and share, hey, like I would really love this position. Is there gonna be an opportunity? And I think that is what we kind of have to do oftentimes.
Mm-hmm.
And that is literally like advocacy in your career kind of looks like, like how do I create opportunities for myself in
Mm-hmm.
spaces that I would like to be in. So shout out to you for doing that and for that opportunity to kind of like come your way that way.
Mm-hmm. Exactly. Thank you. Yeah, you have to advocate for yourself because no one else is necessarily going to. So,
Right, right.
good lesson.
And the worst that they can tell you is no, and then you're in the same position. So yeah, you know,
Exactly.
And then after that role, you were an epidemiologist and project manager at Health Commons Solutions Lab, which is part of Sinai Health. Tell us more about your time there.
Yeah. So I think after I was working in program evaluation, which I really enjoyed, and I was applying a lot of my epi skills, I also wanted to continue to get some more formal experience as an epidemiologist. But it was a great role because, I was working as an epidemiologist, but it was very much a community oriented role. So this is an organization that really focuses on bringing health, design, and equity together. And they really take like a co design approach with patients and community members and different stakeholders. So I kind of divide this role into pre and post COVID. So pre COVID, I was working on, typical population health assessment projects, bringing together different sources of data to understand community health and presenting it to different audiences because I started there in 2019. And then once COVID hit in 2020, like everyone in the health field, it was very much drop everything and focus on COVID, especially because, we were usually more of an independent team and kind of social innovation lab, but we were also housed within the hospital, Sinai Health. So we helped them with their pandemic preparedness plan and response plan, helped to set up community led testing and vaccination sites, worked on strategies to help the communities most impacted by the pandemic, and many more things. So it was a big learning experience. It taught me to be adaptable and learn on the fly. And then at the same time, I started there as just an epidemiologist, but I ended up being an epidemiologist and project manager. So it really furthered my project management skills and my interest in that, and being able to blend my epi and project management skills together.
And what were some of the takeaways on the project management side? What were some of your bigger lessons or things learned there?
Mm-hmm. I think the importance of stakeholder engagement and just figuring out who the stakeholders are who need to be engaged from the get go or as early as possible, and ensuring to involve them throughout the project rather than as an afterthought, like at the end of the project or a certain stage of the project, realizing, oh, we should have been involving this organization before, this group of people before, really trying to do that from the outset as much as possible. And then also just the importance of being very adaptable with project management. I ended up pursuing my PMP certification after that. And well, that's very valuable. It You have to take what you're learning in project management courses and certifications with a grain of salt and really see it as, okay, these are kind of tools that I can put into my toolbox and to use as needed in different contexts. But what you're learning isn't necessarily directly applicable in the real world, and you have to figure out what works in different contexts. And, particularly in the public sector, which can struggle with lack of funding, and during times of upheaval like COVID, you have to be very flexible and you can't necessarily follow project management practices to the T as much as you may want to. So you have to take the most important project management practices and figure out what works for a particular project and context and situation.
Yeah, that makes sense, and I could definitely appreciate that maybe like it gives you a full framework or model to work within, and then you kind of have to see what is actually realistic, considering all the I don't know strained resources, etc. That might be at hand. And in your next role, you spearheaded Canada's first accredited emergency department for older adults when you were the program manager for geriatric emergency medicine at the University Health Network. Tell us about that experience.
Yeah, so that was an amazing experience. And one of the things I'm most proud of in my career, that we were able to do that. So, as I said, I had gotten really interested in project management throughout my previous roles, and I decided, you know what, I want to try to pursue project management more specifically and get some more experience in this area, and also get my PMP certification. But it was a really, really interesting project and a great opportunity. You know, emergency departments aren't a great place for anyone to be, but particularly older adults, unfortunately, they can end up having worse outcomes than they even came into the emergency department with. Just not having what they need and being in bright rooms where the lights never turn off and it's very loud, and especially if they have dementia or delirium and confusion, it can be a particularly negative place to be. So, really, just trying to create a dedicated space in the emergency department with them, having reduced light, reduced noise, dementia friendly considerations, accessible hallways and accessible furniture, non-slip floors, lots of different things. And combining that physical aspect with also having a comprehensive model of care. So, including physicians, nurses, occupational and physiotherapists, dietitians, social workers, really having like a wraparound comprehensive care model, and then also connecting them with the resources that they need in the community so that hopefully they don't have to come back to the emergency department, because that often, happens over and over again. Maybe people get out of the emergency department, but they don't get the supports they need in the community, so they have to keep coming back over and over again, or get admitted and just stay there for a long time because they don't have anywhere else to go. And then doing more research and education about geriatric emergency medicine as well. It's a growing area and quite a specific discipline, so there's a lot to learn and to share about that. So basically, those were the different elements of the program that we were looking at. And there was a donor who was very interested in funding this work, which was wonderful. So my role was basically to put together a proposal that contained those different areas: the space, care, community, research, and education aspects, bring together the different stakeholders. So it was a ton of different stakeholders, the donor, the foundation, the architects and designers, the patients and families, the clinicians, the executive leadership, bringing them all together to make a plan for what this would look like, and putting together a proposal for the donor to hopefully fund. And fortunately, she decided to fund it, and we were able to get a $52 million donation to do the work. And that was extremely exciting. It was a huge learning experience, and a lot of work that I wasn't familiar with before. I didn't know anything about architecture or design, so I learned a lot about that. But a big lesson from that was, learning that you don't have to know everything or have all the answers. And the most important role of a project manager is really stakeholder engagement and bringing together the people who have expertise in different areas and helping them to connect with each other and get things done.
Well, kudos for you on supporting that work. That sounds very meaningful, and I always think about older populations, geriatric populations, and especially in more wealthy nations as Canada, the US. We're having a growing geriatric population, and there are specific needs that they have, and many times we don't create environments that are most supportive of those things. So I'm glad that you were able to lead some of that work, and I'm hoping that it helped support maybe other geriatric emergency departments in Canada afterwards as well.
Thank you. Yeah, it's definitely something that's growing, and there's more of a recognition around the world that there's a need to support older adults specifically in the emergency department, and that it is a specific field like geriatric emergency care or seniors emergency care. So it's exciting to see it grow.
And where I think we met was when you were working at Moxie Public Health. You worked as senior public health consultant and later director of operations. I want to say we met, I don't know, 2, 3 years ago at APHA. Um,
Yes.
and always good to come full circle and to have you on the podcast. But when you were at Moxie Public Health, how did you get into that role, and what did you do?
Yeah, great question. So, in general, I had been curious about consulting for a while since we've talked through my career journey. I've had a number of diverse experiences at different types of organizations and in different roles. And I always liked trying new things, but I could never really pick one particular area that I wanted to focus on. And I also always really enjoyed working with small organizations and small teams. I really enjoyed that earlier in my career. So I felt like consulting was a good way to combine those different things, combine my different skill sets in project management, community and stakeholder engagement, epidemiology, program evaluation, and to be able to work on a variety of different projects with a variety of different stakeholders. And I was lucky enough to find that opportunity actually through the PH Spot newsletter. If people aren't aware, PH Spot is a great public health professional development organization, and they have a weekly newsletter with different career opportunities. So that was in the newsletter one week. So luckily, I was able to find out about it through there, and really had a great experience working there. I learned a ton. We were very focused on community health needs assessments or community health assessments and community health improvement plans, or CHIPS for short, or sometimes they're called implementation strategies with hospitals. So the local public health departments and hospitals were really the clients that we focused on, and really taking them throughout the process of engaging communities and collecting different types of data, making sense of it, and then using it to make improvements and help them to make a plan to do that. So, very interesting work. And then I was also able to support things like business development and finding new clients, marketing and communications, and just learning about how to run a small business and working with a great team to do that.
And it seems like that opportunity where you say like, oh, I was interested in consulting, then you find an opportunity to kind of like get your feet a little wet, not through like your own personal consulting, but through supporting another consultant. And I would imagine that it seemed like something that definitely resonated as you have your own consulting business now. But wanted to ask, like, how did you use like your prior experiences, your PMP, your epidemiology skills to really, how do you leverage that in this role?
Yeah. So I think I was able to use all of my different skill sets in different ways. I'd never necessarily done a community health needs assessment or a community health improvement plan specifically before, but I had done lots of elements of them. I'd done interviews, focus groups, and surveys, and I'd collected and analyzed secondary data, and I'd visualized data, and I'd written reports, and done a lot of stakeholder and community engagement and done project management. So I think it was kind of using all those different skills for different aspects of the process and putting them together in terms of the work with clients. And then I think my project management skills in general really came in handy both for managing the client work, because we were working with a lot of different clients at once and had competing priorities and deadlines, and had a small team and limited resources in terms of ability to delegate with people, and then also being able to balance that with the business development and marketing work. So it really felt like the right role. They came along at the right time to be able to combine all those different things together.
And you're a founder and CEO of Piat Public Health. What inspired you to launch your own public health consultancy?
Yes, great question. So I officially launched Piat Public Health full time several months ago. Pretty recently. And what really inspired me to do that was a desire to do more public health consulting, specifically in Canada. I was lucky enough to get this experience that I had before in Canada, and then also to get some experience in the US. And so I wanted to bring that consulting experience back closer to home, and focus more on communities in Canada. And then, to also build something of my own that felt personal and lasting. So it kind of felt like a natural next step in that way. And I was always really passionate about centering community voices and making data actionable. So that's really what I focused on with Piat Public Health. So engaging with communities, helping their voices be heard, and then turning those insights into action to be able to create change.
And how do you approach projects to translate um, action or like translate into impact?
Yes. So it always starts with listening. So listening to organizations and the clients that I'm working with, listening to communities. They know what they need. Often it's just about listening to them and giving them the space to share it. And then pairing that with things like quantitative data that we already have to build a picture of what's happening in a community and why, and then making sure to translate that data into something that people can actually use. So that might be taking insights and putting them into a strategic plan, and collaborating on that strategic plan with communities and stakeholders, visualization of data. So what I had talked about before is our insight to impact roadmap at Piat Public Health. So really starting with that understanding, going to insight, and then moving to strategy and action, and then always just making sure that we're listening to people at every step of the way. So it's not just community engagement at the outset and doing some interviews, focus groups, and surveys. It's actually involving communities at every step of the process, and making sure that we've interpreted the data correctly and that they agree with the priorities that we've selected for a strategic plan, for example, and actually getting their input on the strategic plan, and keeping them updated on its implementation and providing opportunities for continuous feedback. Um, that's something that's really important to me rather than just doing that at one phase of the process.
Love it, love it. Centering the voice of community, I think, is like what we live for in public health, and I'm glad that you're able to do that in your work. How did you come to developing like this your roadmap? Like what was that development process like for you?
Yeah, so it was based on the work that I had done before for many years with communities, both in terms of developing or conducting community health needs assessments and the improvement plans, but it can be really applicable to other types of processes as well. It doesn't need to be a needs assessment and improvement plan. It could be a program evaluation or a different type of strategic plan, or even just a different type of project. So it was really kind of the learnings that I had taken from the different roles that I had had, and thinking about the different steps that are important to follow, and then always making sure that the community is involved at every step of the process. and then turning it into something that's hopefully easy for people to understand, and that, I can apply in my work, but then others can also apply in their work as well.
And in your opinion, what makes a good community health needs assessment, community health assessment, or CHIP?
So I think the most important thing is actually wanting to do it, and caring about doing it. In the US, as I'm sure many people are aware, CHNAs and CHIPs are mandated for hospitals to do, and then health departments have to do them if they want to be accredited. It's a little bit different in Canada and I think other parts of the world. I mean, they're definitely done worldwide, but they're not necessarily as regimented as they are in the US. But what can sometimes happen is that people think that, okay, I have to do this, and they just see it as a check the box exercise, and they don't necessarily care about how it's done or the outcome as much. I think people often have good intentions, but you know they take a lot of resources and time and effort to do as well. So it can be easy to just do one to get it done. But I think wherever possible, it's important to actually care about doing it, and to understand the reason why it's being done, and to get buy-in for doing it, and to know that people are actually going to care about the results of it, and to use the results to make a change. As I talked about before, obviously it's really important to engage communities from the start, not just at the beginning, not just at the end, and ensure that the findings of the CHNA are actually being used to feed into strategy. So, like, the needs assessment report isn't just sitting on a shelf, and the community health improvement plan, or CHIP, isn't just a nice plan that's sitting on a shelf. Ensuring that the findings from the needs assessment actually feed into the CHIP, and that the CHIP is actually used, and that it's an actual realistic plan to follow. Sometimes there can be a temptation to say, okay, all of the community health priorities are important, and we're going to focus on all of them, which of course they are all important. All health issues are important, but you can't focus on everything at once. So you have to pick a couple of realistic priorities, to focus on, and goals that can be accomplished within a particular amount of time, and recognizing that one organization can't do it all themselves. It's really important to collaborate with, have the hospitals and public health organizations collaborate with each other, and then also collaborate with community partners, and to continue this collaboration, like not just collaborate for the sake of the CHIP, but to have ongoing collaboration to ensure that it's actually implemented, because no one organization can do it themselves. And the more that they collaborate, the more effective the plan is going to be.
That perspective of like knowing that people who want it, I think as the first reason for like having a successful any assessment is like knowing that people, they want this assessment, I think is a great way to view it. Because yeah, too often, and it's still to this day, I think that's one of my biggest pet peeves in public health, is there are so many community health needs assessments that are on the shelves that nobody hears about, that a lot of good data, good insights is just sitting somewhere. And I feel like in that there's a lot of opportunity, and we need to do better to show some of the work that we're doing in spaces. And I'm glad that like you are doing some of this work to ensure that it's not just sitting there, but you're also creating ways to have digestible information so people can take it in and not just read like this 54 plus page report or 200 plus page report, which we know most people are not going to read. So yeah, appreciate you sharing that. So considering that you've gone full time now, what are the services that you offer at Piat Public Health?
Yes. So we focus on needs assessments, evaluations, strategic plans, and project and program management. So really helping people go from insight to impact, engaging communities, understanding the data and using it to make an impact if they need support with that entire process or if they need support with a particular part of the process. So they need a focus group or a survey or to analyze some data or to create a strategic plan. It's really tailored to the organization's needs.
Awesome, awesome. What do you like most about your work, and what is most challenging for you?
I like seeing my work make an impact and seeing what we hear from communities actually get put into practice, kind of like what we're talking about before, basically the opposite of having a report sit on a shelf. Having that report be read and people say, oh, I didn't know about this issue going on in the community, or I learned something more about this issue, and we're actually going to use that insight to create a strategy to address it, and then seeing that actually work is really rewarding. Sometimes it's as simple as bringing two people or two organizations together. Maybe they're doing similar work or work that could benefit each other, but they just didn't know about it in the first place. So it doesn't always have to be new programs or spending more money or complicated things. Sometimes it's just about relationships and making connections.
Did you share what was most challenging?
Oh, no, I didn't. I didn't share.
Okay.
It's not challenging yet.
Checking if I missed this.
No. Good question. So, yes, most challenging, I think, is doing true community engagement, that isn't just, again, like community engagement for the sake of it or something that looks like community engagement but isn't really in-depth community engagement. Like if you actually want to engage communities at every step of the project and process and truly work towards health equity, it's not easy and it takes time. And it also helps to make the work more effective and sustainable and not just a check the box exercise. So that is challenging to do effectively. And I'm always learning about how to do it better. But it's also very important and rewarding.
And then a question from past week's guest. How do you take care of yourself and stay motivated in this work?
Yes. So I think realizing that I can't do everything by myself and relying on my community and relationships, professional relationships, personal relationships, friends, family, and taking time for myself as well. Trying to get better at setting boundaries, and then also doing things that support both my mental and physical health. And I love to be outside. I always feel better when I go outside. I didn't actually go outside today, so that's a problem. I need to go outside after this and get a little bit of fresh air, but that always helps and makes me feel better.
Love it, love it. And yeah, I hope you get to go outside into those crisp Toronto air.
Yes.
Shifting you to the Furious Five, the five questions that we're going to ask all guests. Number one, what advice would you give to a student trying to pursue a career in public health?
Be curious and flexible. Your career doesn't have to be linear, and it's okay to be interested and try different things.
Number two, if you were talking to someone wanting to get into your position, what advice would you give them?
Gain a variety of skills and experiences, figure out what you like and what you don't, build your network, talk to as many people as possible in the field, and take advantage of all the professional development and mentorship resources out there.
Number three, what's something you're working on improving in your life right now?
So as I talked about before, I'm trying to get better at setting boundaries in my professional and personal life and know that I can't do everything myself. Sometimes I need to delegate and to know what's right for me and what isn't.
Number 4, professionally, do you recommend anything?
So I would recommend the PH Spotlight podcast, another great podcast in public health. And in terms of a leadership and entrepreneurship book that I recently read, I would recommend Rewrite Your Rules by Morgan DeBon.
Okay. Haven't heard of that one. So thank you for adding another book to the list of books that I have to read at some point in time. And then number 5, last but not least, if there was one piece of advice you'd give to your younger self, what would it be?
You can do anything you set your mind to. You don't have to wait until you feel completely ready. Say yes, and it's okay to figure it out as you go.
Ali, thank you so much for coming on and sharing your story and sharing how you got to starting and doing the work that you were doing. Greatly, greatly appreciate you and learning more about your story today.
Thank you so much, Omari. It was great to chat with you.
Yeah, pleasure truly is mine. Housekeeping items, everyone. Thank you all so much for watching. Be sure to subscribe, leave a like, leave a 5-star review, and share it with a friend. Really helps the show get out to more people. Appreciate you all. Hope you all have a good rest of your week. Peace, everyone.